We have a very serious identity crisis within the chiropractic profession. Many of our practitioners don't understand what unique professional objective that they apply to their practice. The community doesn't understand what we do and thinks that we provide some sort of treatment for low back pain. Knock on wood, doc. I never had back pain. I don't need a chiropractor. We have a significant problem in our ability to communicate what we do and to have confidence in what we do. And the topic that we're going to discuss in the next few minutes is what you bring to the table. And I hope that you will get an enthusiasm as a result of this talk to go out and study chiropractic and its unique professional objective and the philosophy and the science that support that professional objective and get really, really good at the art of providing chiropractic care. I want you to know beyond any shadow of a doubt every time the phone rings that your principles, your philosophy, your art, your science, your professional objective that you own in your heart and in your head and your hands, that you can handle any situation that would come your way based on your ownership of chiropractic, what you bring to the table. Well, 19th century English art critic John Ruskin was credited with the saying, "When love and skill work together, expect a masterpiece." When love and skill work together, expect a masterpiece. And B.J. Palmer liked that saying enough to put it as an epigram on the walls or in the halls of the Palmer School of Chiropractic. And I can only imagine a scenario where I might be sitting in a philosophy class led by B.J. Palmer, smoking his cigar in the front of the lecture hall and talking about perhaps a couple from Ohio that came to the Palmer School and embraced everything that they learned and the importance of the upper cervical spine and how to locate, analyze, and correct vertebral subluxation found in the upper cervical spine. And they didn't feel the need to add a bunch of things to their practice. And they went to Ohio and did what BJ told them to, and they were hugely successful, building a large practice. And then there was another couple that came and they didn't get it. They didn't have the love. They didn't have the skill. And they went back to wherever they were from and they failed. And they didn't build a huge practice. And they tried to add some other things to the practice to make a bunch of other money and it didn't work. And in time, they just pursued other careers, perhaps real estate or something like that. And I'm sitting there and I'm thinking, I want to be the one that leaves this school with the love and the skill so that my life is a masterpiece. My practice is a masterpiece. The lives of my patients are masterpieces. And I go into the halls and I read, "When love and skill work together, expect a masterpiece." And I go down the hall to my technique class and I'm just thrilled with where I'm at and what I am becoming. Well, I love what Dr. Caroline Leap has to say. And she says, "Your purpose is not the thing that you do. It's the thing that happens in the lives of others when you do what you do. And when you have a firm grasp of the principles of chiropractic, the philosophy, the art, the science, the professional objective of chiropractic, and you communicate that and you inspire these people in your community to allow you to do this thing that you do. And what happens in their lives? Do they sleep better? Do they have more energy? Does their body function at a level that it reduces or eliminates disease processes? Do they communicate with their children? Do they raise their children? Do they meet their potential? What happens in the lives of the people who you lay hands on and apply your art to and your purpose of locating, analyzing, and facilitating the correction of vertebral subluxation simply because subluxation is bad and correction thereof is good. And when you allow the bigness of life to express in your patient at a greater level, amazing things happen. And it's your purpose to communicate that and to deliver that to as many people, and in our case, animals, as possible. Well, we have a mission statement at the Foundation for the Advancement of Chiropractic Principles and Freedom and Light Force Adjusting Methods, and that is to foster confidence, competence, and certainty in the basic and fundamental principles, the philosophy, art, science, and professional objective of chiropractic applied to people of all ages and animals of a variety of size and species. The verb to foster means to nurture and develop, and it is our goal to help as many chiropractors nurture them and help them to develop a confidence, competence, and certainty, a level of confidence, the feeling or belief that one can rely on someone or something. Can you instill confidence in your community, in your patient, that that they can rely on you to have to be able to deliver the goods? Are you competent? Do you have the ability to do something successfully and efficiently, i.e., locate, analyze, and facilitate the correction of vertebral subluxation? Are you certain? Do you have that firm conviction that something is the case, i.e., I have communicated what I do? The patient has understood what it is that I do and the unique objective that I have. And then I've laid them on the table and I've done my examination and I'm delivering my chiropractic adjustment. I'm certain in this entire process, confidence, competence, and certainty in the basic and fundamental principles of chiropractic. Principle is a fundamental truth, a law, an assumption that serves as the foundation for a system of belief, behavior, and reasoning. And chiropractic is a system of belief and behavior and reasoning based on principles. Principles act as guidelines or rules that help in understanding, in our case, our chiropractic judgment and decision-making process, our clinical judgment and decision-making process. Is there a subluxation present that I can safely and effectively facilitate the correction of through my adjusting technique and procedures? Our chiropractic principles serve as the foundation for our philosophy, our science, and everything that we do and communicate, which forms our professional objective. We have 33 fundamental principles in chiropractic, and I graduated from a school that may have mentioned them in about 10 minutes of our academic career, as opposed to other schools that have them printed on the walls and they're communicated within the classrooms and so forth. But in 1927, R.W. Stevenson wrote the chiropractic textbook about the and names the chiropractic principles, our 33 principles. Dr. Joseph Strauss has a commentary on Stevenson's textbook. He goes through the whole thing and provides his commentary. And so we can read his commentary on the 33 principles. And Dr. Claude Lessard has updated this chiropractic textbook by Stevenson, released in 1927. Dr. Lessard's book is released in 2027. Volume 1 has already been released. Volume 2 has already been released. And by 2027, all 4 volumes will have been released. Dr. David Koch wrote the Contemporary Chiropractic Philosophy and has reorganized and reworded some of the chiropractic principles. I prefer Stevenson's original 33, but I study the others to see how they are all interrelated. And I'm embracing the 33 principles and making it my goal in 2025 to have them memorized and be able to discuss them on a deeper level. And if it's the 20th of the month, I will study principle 20. And if it's the first of the month, I'll study our major premise and principle number one. And I study a principle every day. And then when I get to the end of the month, I study the four, the four last principles. And um, Stevenson says on page, gosh, what is that? 25, 28 of the chiropractic textbook in the introduction. The difference between a good chiropractor and a poor one is that the good chiropractor has an ample supply of abstract principles in his head, and the poor one only a few. And I believe that one of the things that we can do to fill our brain with a bunch of abstract principles is to read chiropractic the chiropractic principles in all of the old works, the Green books, Didi's books, some more contemporary things, Fred Barge's books, and make yourself a student of chiropractic principles of Stevenson, of Didi's, of BJ's, and just fill your noggin with these abstract principles. We have basic and fundamental principles. Our basic principle is this: life is the expression of tone. In that sense, is the basic principle of chiropractic. And I wonder how many chiropractors say, no, chiropractors, the manipulation of stuck joints to reduce pain and inflammation. What's the expression of tone? And I think that that's a complex concept, and it's not just as simple as, well, it's muscle tone. And if I manipulate a stuck joint, then it relaxes the muscles and that improves tone. So that's probably what Didi was talking about. I think it's a lot bigger than that. It's a lot bigger than that. In that sentence is the basic principle of chiropractic. Then we have our 33 principles. Number 1 through 19 are universal principles. They could be applied to anything in the universe and in science and in life. Numbers 20 through 29 are innate principles, applying those universal principles to the individual and the innate in self, or the individual self. And then the last 4 are the chiropractic principles. And our principles direct and support both our philosophy and our science. And I want to be a good chiropractor, and I want you to be a good chiropractor. And the difference between a good and a poor chiropractor is one's enthusiasm, perhaps, for filling one's brain and heart and hands with chiropractic's unique and fundamental principles. I like principle 4, the triune of life. Life is a triunity having 3 necessary united factors, namely intelligence, force, and matter. And one of my chiropractic heroes, Reggie Gold, did his PhD dissertation on that one principle, the triune of life. And the book concludes, the last sentence or two, unless and until the triune of life is restored to its natural perfection, life must of necessity be diminished. That is the principle of chiropractic. Life is a triunity having 3 necessary united factors: intelligence, force, and matter. Principle number 4, the triune of life, the one of the 33 that could be pulled out and stand alone. And then we have our chiropractic philosophy. The philosophy is the study of the fundamental questions about existence, knowledge, values, reason, mind, and language. It involves critical analysis and rational argument to explore these questions, often addressing abstract conceptual issues. Chiropractic is a philosophy. Chiropractic has a philosophy. And you are a chiropractic philosopher, whether you know it or not. Even if you think that chiropractic is just the manual manipulation of stuck joints to reduce pain and inflammation, that's a philosophical understanding of chiropractic. But I think with further exploration and further passion and a desire to learn more and more and more about the basic and fundamental principles, you'll have a deeper understanding and a bigger picture of what we do, and you'll bring more confidence competence, and certainty to the table. Because, quite frankly, many of our educational institutions and our national boards and what we might call the cartel that is running the chiropractic profession, maybe it's the medical profession that wants to keep us in a little tiny box, keep us in our place, call you a doctor, but you have to be a doctor of the musculoskeletal system. You treat back pain. If the patient wouldn't be better served by a massage therapist or an orthopedic surgeon or a neurologist. I want you to have confidence, competence, and certainty in the philosophy of chiropractic. Don't think of it as something religious. Don't think of it as something that's voodoo. Don't think of it as something that's worthless because my state board won't allow me to get continuing education in philosophy. How stupid is that? The notion that the thought process of the chiropractor, the unique professional objective that the chiropractor brings to the table is not worthy of continuing education. So I ask, is there a difference between philosophy and chiropractic philosophy? Well, philosophy is a study with different branches and metaphysics and ethics and politics and aesthetics and different. The study of philosophy is a study, and then we apply that to chiropractic. You know, do you have your own chiropractic philosophy? Well, yeah, I think joint manipulation is a good thing in some cases, or the power that made the body heal the body. That might be somebody's chiropractic philosophy, above, down, inside out. Well, that is, those may be good ideas. Those might be good thoughts, but that's not really what having a passion for chiropractic philosophy is. It's not just medicine's bad and chiropractic's good. It's not that, well, chiropractic as a philosophy is the underlying understanding of why we do what we do, why what we do works. It kind of goes back to that Caroline Leaf quote that we started with at the very beginning. Your purpose is not that thing that you do. It's the thing that happens in the lives of others when you do what you do. Yeah, it's good to be a chiropractic philosopher, but it's the thing that happens in the lives of others when your philosophy causes you the boldness of communicating with passion that, hey, if I locate, analyze, and facilitate the correction of vertebral subluxation in your child, that could result in something great in your child that was born premature with the cord wrapped around the neck and is suffering colic and is suffering torticollis and is only pooping every 3 or 4 days or whatever. With a firm understanding of the foundation of chiropractic philosophy and principles, one has greater level of confidence, competence, and certainty in every communication and every interaction that we have with our community and our potential patients. Does everyone get a chance to have their own chiropractic philosophy? I don't believe so. I don't think that, some might say, my philosophy is not to have a philosophy. Well, that's maybe a philosophy in and of itself. But I really think that if you're going to call yourself a chiropractor and you want to be a good one, as Stevenson made the distinction between a good chiropractor and a bad chiropractor, you study and embrace the principles and philosophy of chiropractic, and you bring that to the table, to the phone, to your hands with every single interaction that you have with another human being or animal. Chiropractic has a unique professional objective, and I believe that this is probably one of the most important things that we can embrace as chiropractors. This professional objective that's derived from our principles, derived from our philosophy, derived from our science, should be the foundation of everything that we do. Chiropractic is a unique profession. Chiropractic is not a subset of medicine. The chiropractor is not simply a musculoskeletal doctor. Over the years, there have been at least four different and distinct professional objectives of the chiropractic profession. It was originally thought that chiropractic might be the cure of all disease. Well, clearly, chiropractic is not the cure for all disease. So some then would say chiropractic's the cure for some diseases. But then the logical next question becomes which ones? Is chiropractic good for musculoskeletal conditions, but not digestive disorders? Is it good for neck pain, but not knee pain? Is it good for one condition, but not another condition? Nobody gets to choose. Or let me ask that: who gets to choose which diseases chiropractic is good for and which is it's not for? Or is chiropractic bigger than curing some disease, but not others? Some might say chiropractic gets sick people well and keeps well people from getting sick. Well, that is certainly a true statement. Sometimes people get well while under chiropractic care, but sometimes they don't. And sometimes having a properly functioning nervous system might keep one from getting sick who would otherwise get sick. But that's not the unique professional objective of the chiropractic profession. In my opinion, the unique professional objective of the chiropractor is to locate, analyze, and facilitate the correction of vertebral subluxation as defined by the chiropractic profession. And I would argue there is no other profession that does that. There is no other profession that defines the chiropractic vertebral subluxation as we do. And there is no other profession that is uniquely qualified and committed to facilitating after they have locating, analyzing, and facilitating the correction of vertebral subluxation. I think it's very important to put that word facilitate in there. I am not the adjuster. I am not the healer. Innate intelligence that is contained in the life of the patient is the adjuster. My job is to facilitate the correction, and it is the job of innate intelligence to do the healing because only it knows how to do the healing. Well, if we have a professional objective that is to locate, analyze, and facilitate the correction of vertebral subluxation as defined by the chiropractic profession, simply based on the idea that chiropractic vertebral subluxation is bad and affects the quality of life, health, vitality, function, adaptation, coherence, coordination, and facilitating the correction thereof is going to improve quality of life, health, vitality, function, adaptation, coherence, coordination. Well, what is a chiropractic vertebral subluxation? I like what Dr. Jack Borla has done at Sherman College of Chiropractic. We have gotten lazy in our chiropractic communication. We get lazy and we are willing to call subluxation just segmental dysfunction or something other than subluxation, or we don't add the word vertebral to subluxation, kind of sticking our flag in the spine, so to speak, recognizing that other professions take care of subluxation. Certainly the veterinary profession does and the medical profession does, but they have a different definition. And by being committed to calling it a vertebral subluxation, as is part of the Sherman College culture, then that communicates something different. And I oftentimes call it the chiropractic vertebral subluxation or vertebral subluxation as defined by the chiropractic profession. Again, sticking our flag into the term subluxation with our unique definition or definitions. The classic definition of a subluxation as defined by the chiropractic profession is a vertebra which has lost its proper juxtaposition with the one up, the one below, or both, less than a luxation, or what we might refer to as a dislocation, which occludes a foramen and interferes with the flow of mental impulse. We oftentimes don't talk about that last portion of the definition, and it's perhaps one of the most important parts of the definition. This concept of mental impulse, which a lot of chiropractors don't even really think about. I also like the Australian Spinal Research Foundation's definition of a subluxation or a vertebral subluxation. A vertebral subluxation is a diminished state of being comprising a state of decreased coherence, altered biomechanical function, altered neurologic function, altered adaptability. And these are great terms to study and to kind of get a mastery of so that you come to the table with more than a concept of chiropractic it being the manipulation of a stuck joint. I'm going to stop right there and communicate why I never use the term manipulation. And I don't have a staff, but if I did have a staff on day one of training, I would teach them we never use the term manipulation. And even to the extent that if a patient called my office, if I did have a staff and someone asked, does your chiropractor do spinal manipulation? I would teach them that we don't ever use the term manipulation. I don't care if the researchers have to use it. That's a totally different conversation. I will never use the term manipulation. I will never allow what I do to be called a manipulation. Partially that's because I have a history of being in recovery, and my family has a history of being in recovery. And when we have been in rooms with other people who are in recovery, perhaps for substance abuse or codependency or the term manipulate or manipulation, or she's being manipulative, or he manipulates, or something. The term is never used in a good way. I oftentimes say if my wife called her mother and said, Scott's been manipulating me, I'm not getting invited to Thanksgiving dinner next year. The term manipulate just means to change. It doesn't imply you made it any better. It just means you changed something that is adjusted, was not perfect, and now is better. So we always use the term adjustment. And when we adjust, we imply that there's a greater state of being, a greater level of coherence, greater biomechanical function, greater neurologic function, greater ability to adapt. So we use these terms that we believe are chiropractic terms and part of our chiropractic vision and objective, and we bring those to the table versus sloppy conversation like manipulation and segmental dysfunction and stuck joint, etc. There's also an etymology, dividing up the word definition. There's an energetic and tonal definition of subluxation, that being a condition of less light. And sub means less, and shun means the condition of, lux means light. So subluxation is a condition of less light. And, we recognize that there's a structural component to chiropractic and vertebral subluxation. And we use those previous definitions to describe that. And then we recognize there's more of an energetic and tonal definition of subluxation. And we use this idea and explore that. And by bringing both to the table, we recognize that we restore and improve the quality of not only the structure of the patient, but the energetic tone of the patient. Chiropractic words, as I've said, are not pain and dysfunction and disease and symptoms and condition and diagnosis, but rather the improvement or restoration of quality of life, health, vitality, function, adaptation, coherence, coordination. And when we bring these visions and these terms to the table, we do a lot more than just popping stuck joints to reduce back pain or headaches or put a stuck rib back in place. Other chiropractic words are vitalism and salutogenesis. Salutogenesis is a concept that focuses on factors that support human health and well being or animal health and well being rather than factors that cause disease. And our focus and our chiropractic approach and what we bring to the table is largely based on a, a desire to support health and healing and well being rather than simply to reduce symptoms or things that cause illness. I want you to be aware of a research article that was published about last year, directed by Dr. Amy Haas with Dr. Chang and Kent and McCoy. And now, boy, how does Brooke pronounce her new last name? Schussler? Forgive me, Brooke. But amazing chiropractors who write this paper under the direction of Dr. Amy Haas, vertebral subluxation, a systems biology, an integrative review exploring the salutogenic influence of chiropractic care on the neuroendocrine immune system. Basically, a long, wonderful paper communicating that chiropractic, we all know that chiropractic has a fundamental effect on the neuromusculoskeletal system, although some chiropractors focus exclusively on the musculoskeletal system. And I remember Dr. Kent once saying, how can you focus on the musculoskeletal system? Even if you're a pain doctor, you need a nervous system to feel pain. Anyway, chiropractic is so much bigger than just the musculoskeletal system, even the neuromusculoskeletal system. It's the neuroendocrine immune musculoskeletal system, and it's even beyond that. But this paper is something that should give the chiropractor confidence, competence, and certainty that when she locates, analyzes, and facilitates the correction of the chiropractic vertebral subluxation, that she is indeed influencing the nervous system along with the musculoskeletal system and the endocrine system and the immune system. I didn't say boosted. I didn't say fix it. I said influencing it. And I'm going to say in a positive way. So then we have our chiropractic science. We have basic and applied science. We have our 33 principles that not only serve as our philosophical foundation, but our scientific foundation. We study chiropractic and we filter it through, we study science and we filter that through the lens of chiropractic. And I go outside of just the chiropractic profession to learn science. And if you looked at my Audible library and my physical library, tons of books on energy medicine and vibrational medicine and quantum things and the energy field and light and physics and healing and things. Not that I want to be an energy medicine practitioner or not that I want to be a light practitioner or anything like that, but we study science. We study a lot about the fibers, the fascia, the fibers and fluids that make up our body. We learn about the fourth phase of water, that gelatinous state of water that's inside of our body that's highly conductive of energy and information. And we study how a light force placed right here perhaps has an effect on the entire body because of the geometry, because of the biotensegrity of the fascia and the way the body was designed. So, we study chiropractic science and then we study science and apply it to chiropractic. And I encourage you to pick up this book by Dr. Claude Lessard, Chiropractic's Basic Science. He talks about how science we have basic science that we learn from books, anatomy and neurology and physiology and biomechanics, etc. And then we apply that to chiropractic. And we not only have our 33 principles, but we have an entire world of science that we could filter through a lens of facilitating the correction of chiropractic subluxation through our chiropractic care. Well, we asked the question, do we need more research? I just referenced a research study, a compilation by these amazing chiropractors demonstrating the effects and benefits of chiropractic care on the multiple biological systems that make up our body and life. I think the problem with stating that we need more research is the idea that chiropractic as a vitalistic and salutogenic science fits the model of randomly controlled double blind studies. The basic underlying model of which most medical practices and procedures do not have any procedures that are double blind, randomly controlled and still done every day, but somehow we're placed through a higher level of scrutiny than the medical profession that just gets away with anything that they want. And then we are considered non-scientific. But, imagine that, and obviously the world does not need one more study demonstrating the benefits of chiropractic on back pain. But that's a very medical model of looking at things. And if you had 100 people with back pain, ideally to make it randomly controlled double blind, I guess you'd have to take 33 of them and adjust them, and 33 and give them a sham adjustment, whatever that is, and 33 and not adjust and see which group did better. And when in chiropractic, are we ever going to not give chiropractic to those who desire it, or give fake chiropractic to those who desire it? And because we're vitalistic and because we're salutogenic, we need to focus more just on scientific research that might demonstrate the effects of vertebral subluxation on the entire system and the benefit of correcting subluxation on the entire system. But our science and our approach and our philosophy and principles, et cetera, and our doesn't lend itself, in my opinion, to standard chiropractic procedures. And spoiler alert, though, neither do most medical procedures that aren't held to the scrutiny that we are. So I'm going to go on. Chiropractic art. There are chiropractic techniques that fully focus on the structure, and others that focus on posture, and others that focus on the tone. And which ones, because maybe your technique and approach is a combination of several, and that's what you bring to the table. Does your chiropractic technique and you do your chiropractic procedures serve our unique professional objective of locating, analyzing, and facilitating the correction of vertebral subluxation? Do you have a pre-check that tells you, yes, there's a subluxation present here, or yes, the patient is subluxated? And is there the same system to determine when they leave that you have facilitated the correction of subluxation on that visit? Do you have a very specific place to start, system of analysis to locate and facilitate the correction? And do you know that you have done it and it's time for them to leave until next time? Your technique should be an expression of your confidence, competence, and certainty. And I will tell you that what I have been able to do for 31 years now, learning about the interface and learning about monitoring subtle energetic changes that take place in my autonomic nervous system as a result of positive chiropractic findings through my chiropractic analysis, is what has given me a confidence, competence, and certainty in my approach to chiropractic, that I was never going to hurt the patient and that I was only going to help them. And when they go through my door and leave until next time, that they are expressing a higher level of life, health, vitality, etc. Communication. Are you a good communicator? Can you bring that excellent chiropractic communication to your table? Maybe even to the phone when the person calls. Can you help my dog? It has hip dysplasia. Well, I don't have a specific chiropractic adjustment designed to fix hip dysplasia, but I can teach you that the chiropractic vertebral subluxation, when present, serves as a major interference to the ideal expression of the musculoskeletal system, the nervous system, the body's ability to express life, health, and vitality. If I can correct that, then there's a greater chance that your dog is going to function in spite of these perhaps deformities that may or may not go away. Same with degenerative disc disease, same with stomach disorder, same with heart conditions, same with psoriasis, same with anything. We filter everything chiropractically through that communication and that lens. And I ask you, how confident are you in your chiropractic communication? Here's two slides, a chiropractic approach to, and then there's a mess of symptoms and diseases in alphabetical order: whiplash, gonorrhea, gout, lupus, schizophrenia, and sciatica, chronic pain, earache, ADHD, cellulitis, cystitis. What is the chiropractic approach to any of these conditions? Well, I don't have a specific chiropractic adjustment for cold sores or bulimia or a bunion or a food allergy. But what I can tell you, Mrs. Jones, is that if there is a subluxation present in your spine, and your innate intelligence, your innate ability to express life, health, and vitality and healing and function and adaptation is compromised, and we can correct that, that there's a greater chance that your bunion, your brain tumor, your chronic pain, you're going to function and express life. I wouldn't even necessarily give hope that your bunion's going to go away, or your flu's going to go away, or your food allergy's going to go away. But I will tell you this, Mrs. Jones, if you have a subluxation, you are not expressing life, health, and vitality in an optimal way. And if we correct that subluxation, we can facilitate the healing process and the function process and the adaptation process. And that's a greater professional objective than trying to treat your earache or your acne or your dog's constipation or something. Is there hope for an elimination of your sign, symptom, or disease? Absolutely. Is there a unique chiropractic approach to it? No, but let me demonstrate to you the value and the extreme bigness of correcting this subluxation or facilitating the correction of the subluxation in your life, in your child's life, in your animal's life. And, as a human being, I want them to poop like a banshee. I want that pain to go away. I want your headaches to go away. I love you. I'm your brother. I'm a human being, but the chiropractic approach is not to have a unique adjustment for Down syndrome or dehydration or asthma. Rather, to correct what is there. In my world, it's primarily in the upper cervical spine, secondarily in the sacrum, sometimes elsewhere. But if we can get that corrected, if we can get that facilitation occurring, then you have a greater chance of expressing life, health, vitality in a greater way, directed by your innate intelligence. And that's the big idea of chiropractic. I have three questions that I would always ask that would direct my interaction with a patient, my interaction with trauma situation, and who I am as a chiropractor. The three questions are this: is there a medical emergency present that's so dire, so serious, that it would be unethical or inappropriate for me to even lay hands on a patient, be they a human or an animal? I can hardly think of any conditions, but there may be something that would be so medically inappropriate for me to do anything that could keep the emergency practitioners from doing what needs to be done. But is there a medical emergency present that is so dire that it would be inappropriate to even lay hands on this patient or this animal patient? And obviously, 99% of the time, the answer would be no. Number two, is there a vertebral subluxation present that I can safely and effectively adjust? And the answer is most of the time, yes, because And let's go to the third question. Might I need to alter my technique to accommodate some sort of major medical situation or pathology? The answer is likely no, but I'm glad that as a student of light force adjusting methods that I have the ability to take a contact on the sacrotuberous ligament and provide a basic adjustment with no more than 4 to 7 to 10 ounces of force. Can I apply a similar force to the upper cervical spine? Do I have access to gentle procedures that I can do to facilitate the correction of subluxation? Maybe while emergency care is coming. I was called out to our barn to see if I could help this horse, Romeo, who was in a colicky state. And it was a terrible situation because of this. A lot of the veterinary clinics, both small animal and large animal, are now going to a policy whereby if they aren't providing annual vaccines, you're not a patient and you won't be given emergency care. And that's the way the equine practice works here in our community. If you aren't doing annual vaccines with them and getting your horse's teeth floated, they will not come out in the case of an emergency. And Romeo fit that category. He's not under the one office's care and not getting vaccinated every year by this specific office. So they refused him care, and it took the owner to beg and cry before they would come out and administer emergency care to Romeo. Well, they agreed. Very expensive, and she had to give her credit card. But in the meantime, what I did was I was able to take a contact on Romeo's sacrotuberous ligament, both sides and one at a time, and we'd walk him. And when we did that, his system relaxed a little bit, and he would walk forward because his tendency was wanting to just lay down and die. But we were able to take that contact, take my other hand and put it on his sacrum, and just breathe. And he became coherent in our breath, and his parasympathetic nervous system kicked in. And in that case, we kept him alive until the veterinarian came and administered medical emergency care. And that was a case where, no, I was maybe not going to, I maybe could, maybe couldn't have expected his colic to go away as a part of my chiropractic intervention. But that's not the big idea. The big idea is there a subluxation present? Can I alter my technique to help the situation? Perhaps it's a medical situation that requires all additional medical care. Perhaps it does not. That's not really for me to determine. The question is there a medical emergency present that would keep me from doing what I need to do? Or number two, is there a subluxation present and can I safely and effectively correct it? So to foster confidence, competence, and certainty in the basic and fundamental principles, the philosophy, art, science, and professional objective of chiropractic applied to humans of all ages and animals of a variety of size and species. When love and skill work together, expect a masterpiece. You bring love, you bring skill, you bring purpose, you bring a passion for chiropractic, but you also bring yourself, and you bring hope, and you bring honor and integrity and passion and kindness, enthusiasm. You bring your presence, being present with your patient, being present time consciousness is perhaps one of the greatest things that you offer an animal or a human. Being present. You bring all of these things to the table, and I just encourage you and hope to inspire you to gain more clarity on what chiropractic is, what you bring to the table, armed with a passion, armed with honor and integrity and enthusiasm and presence, armed with the principles of chiropractic, armed with the philosophy of chiropractic, armed with a professional objective that dictates everything that you do. You can stand on that. Armed with being a great artist. This is what you bring to the table. You also bring a sensory nervous system. You also bring a central nervous system. You also bring an autonomic nervous system. And you bring this entire thing called chiropractic. And when you take in information through your sensory nervous system that you can apply to your clinical judgment and decision making process, and your brain processes the information coming in from your sensory nervous system to assist in the judgment and decision making process. And you have your autonomic nervous system, in our case, this sweat gland activity is part of your sympathetic nervous system. And this balance between sympathetic and parasympathetic, sweaty and smooth, sweaty and smooth. You bring your sensory nervous system in, and your sensory nervous system is more than just your five senses. You have so much more to your sensory nervous system, chiropractor, in your ability to locate, analyze, and facilitate the correction of vertebral subluxation. Your central nervous system is uniquely qualified because it also contains your educated, along with your innate and your intuitive and your autonomic nervous system, to confirm what you think and what you will do. You bring this to the table, and that's really what the value of the light force adjusting methods, and specifically the interface chiropractic analysis, is all about. Interfacing, the point in which all of these systems and organizations and people come together. In this case, your educated intelligence, your innate intuitive intelligence, your sensory, central and autonomic nervous systems, your intuition, all that coming together and being monitored by subtle energetic changes in your fingertips. That's what we do. What you bring to the table is of huge importance. And I am grateful to the chiropractic legacy, the life, the love, the professional contributions of one Dr. Ian Toughness, because were it not for him and were it not for his challenges and detractors, I would not have the confidence, competence, and certainty that I have in chiropractic, in my approach to it, and the confirmation that I get from what I learned from his work gives me confidence, competence, and certainty. And I so desire to give you that same.